Hello, my name is Andrew Yee. I'm an instructor in medicine at Harvard Medical School and at Massachusetts General Hospital Cancer Center in Boston, Massachusetts. I'm here to present at ASH the results of a study that we entitled ACY-1215, a selective histone deacetylase 6 inhibitor in combination with lenalidomide and dexamethasone is well tolerated without dose-limiting toxicity in patients with multiple myeloma at doses demonstrating biologic activity. Interim results of a phase 1b trial. Our study looks at ACY-1215, which is a selective histone deacetylase 6 inhibitor. And histone deacetylases have multiple functions in the body. Many people generally think of histone deacetylases as regulating gene transcription. And there are currently several trials looking at histone deacetylase inhibitors in multiple myeloma, such as panobinostat and vorinostat. In our trial, we look at ACY-1215, which is a selective HDAC 6 inhibitor. Now, what makes ACY-1215 unique compared to other histone deacetylase inhibitors is that it targets only histone deacetylase 6. And we think that most of the biological activity of ACY-1215 that is relevant to multiple myeloma occurs in the cytoplasm, specifically with its effects on protein degradation. Now, as many in the audience may know, the protein degradation pathway, such as the proteasome pathway, is an important pathway for targeting in multiple myeloma, drugs like, for example, bortezomib and carfilzomib. Now, it turns out that there are other pathways that are biologically relevant in protein degradation, such as the agrosome pathway. And by inhibiting histone deacetylase 6, preclinical studies have found that has strong effects on the agrosome pathway and causes significant amounts of stress to multiple myeloma cells. So with those findings, that motivated us to combine ACY-1215 with lenalidomide and dexamethasone. In this phase 1 trial, we looked at patients who had relapsed and/or refractory disease. To meet, the patients who were eligible for this trial had to have one prior line of therapy, as well as adequate hematological and renal reserve. We looked at the combination of ACY-1215, which is orally available, in combination with lenalidomide and dexamethasone on a standard 28-day schedule. So lenalidomide was given for 21 out of 28 days, combined with dexamethasone weekly. ACY-1215 was given orally Monday through Friday for the first 2 weeks and 2 weeks off, and subsequent cohorts will have 3 out of 4 weeks. We found that the combination of ACY-1215 with lenalidomide and dexamethasone was extremely well tolerated. The adverse effect profile was very similar to what you would expect with lenalidomide and dexamethasone by itself in a relapsed and refractory patient population. So the typical toxicities you would see, we saw some fatigue, as well as hematological toxicities, as well as infections, but the amount of the amount of these adverse events we think is very similar to what you would expect with lenalidomide and dexamethasone alone. And this is in contrast to, for example, non-selective HDAC inhibitors, which tend to have more side effects such as gastrointestinal side effects such as diarrhea or nausea. And what makes this trial unique is that we really didn't see much in the way of any significant gastrointestinal side effects, for example, in this combination. So we're really excited that, for this patient population, that we have a combination that is very well tolerated and also very effective. 16 of our patients were available for response, and our overall response rate of partial response or better was 61%. Now, it's important to note that the majority of the patients in our trial had prior lenalidomide therapy. 81% of patients had prior lenalidomide therapy. And more specifically, six patients in the trial were felt to be refractory to prior lenalidomide therapy. Of those 6 patients, 3 of those patients had a minimal response or better. So I think this is what is important to note is that we're able to achieve responses in patients who've had prior lenalidomide therapy, as well as patients who are refractory to lenalidomide therapy in this combination with ACY-1215. We think these findings are extremely encouraging. We did not find specifically that there were no dose-limiting toxicities with ACY-1215. And we feel that ACY-1215 will be a very important partner in future drug combinations. Since, as many people in the audience know, combination therapies will be important to providing the best effective care for patients with multiple myeloma. Importantly, we find that, again, that this combination didn't have much in the way of significant adverse events, and in fact, probably not more so than lenalidomide and dexamethasone alone. Moving forward, we're planning on accruing more patients to study, testing higher doses of ACY-1215, as well as different dosing schedules. We're also looking forward to other studies of ACY-1215 in combination with bortezomib, which are also being presented at this year's ASH as well. And we're looking forward to partnering ACY-1215 with future drug combinations as well.